The next structures we want to visualize is the posterior middle aspect of the knee. This is easily visualized by continuing to follow our scan pattern from the biceps femoris, scanning across the posterior knee toward the medial side in a longitudinal scanning plane. Let's review the anatomy of this area and review our checklist, which will include the posterior cruciate ligament, the popliteus muscle and popliteal vessels, and the sciatic, tibial, and peroneal nerves. When we examine the posterior middle aspect of the knee, the key structures we want to understand their anatomy are the posterior cruciate ligament, the condyles of the femur, both lateral and medial, the medial and lateral posterior horns of the menisci. As we add layers here, we will see how these sit on top of the tibial nerve and common peroneal nerve, and the popliteus muscle again, and our two heads of the gastroc, medial and lateral. Let's review the posterior cruciate ligament. This ligament runs in an oblique fashion from the medial femur to the lateral tibia. It helps prevent posterior translation. Only the very distal insertion of the ligament can be seen with ultrasound, as depicted in this view. It is important to toggle the probe slightly towards the medial aspect, towards its origin to catch it. Sitting above it is the popliteal artery. This is the scan position. Let's review how to scan this. The next structure we're going to look at is the posterior cruciate ligament. We're again going to continue our scan as we did, looking at the lateral meniscus with the femoral condyle above and its cartilage. Once I have the meniscus and the joint in the center of the screen, I will then slowly bring my probe across until I can come up to a black structure that sits just above the tibia. This is the insertion of the posterior cruciate ligament. We only see its distal insertion because it comes through and we lose it as it goes in the joint. Do note that there's a slight medial pivot to my probe here, going towards the medial aspect to better line up with the PCL. Let's review now the popliteus muscle. The popliteus muscle is best seen in a short axis approach, sitting on top of the tibia. It makes a nice bed for the popliteal vessel. The muscle turns into a tendon as it wraps around the lateral aspect of the knee to insert in the popliteus hiatus, as we saw earlier. Popliteal artery and popliteus muscle underneath the tibia. Probe position in the popliteal fossa. Let's review how to scan this. Our next structure to look at is going to be the popliteus muscle, looking at it from the posterior aspect. The popliteus muscle is easily seen in a short axis approach by placing the probe again over the popliteal crease, looking at our two bony landmarks, looking at our neurovascular in the direct center. Once we see the neurovascular, we will then bring the probe down distally. As the probe goes distally, you will see a muscle sitting just underneath the popliteal vessel, which is the popliteus muscle, and it's sitting just above the bed of the tibia. This muscle runs in an oblique fashion towards the popliteal hiatus. A short pivot of my probe allows me to line up of the muscle as it comes up and above in this direction. Let's now review the popliteal vessels in greater detail, along with the neuroanatomy. This is the position for looking at the popliteal vessels in long and what the popliteal artery looks like with the PCL below. Here is the short position. When we look at this, we want to find the two condyles of the cartilage and then look for the nerve to sit in between the two with the vessels situated below it. It is important to bring the patient up into a little bit of on their toe to help decrease the vein from collapsing. Here's the vessels with Doppler on, with the nerve on top, sitting nicely between the two condyles. Let's review how to do this.
Our next step will be to look at the posterior middle aspect of the knee and looking at the neurovascular structures. These structures are easily visualized by placing the probe in a short axis approach in the popliteal crease. Once I'm in the crease, I look for two large bony landmarks. The bone of the posterior aspect of the tibia with its cartilage above, and the medial aspect as well. On the lateral aspect, it's important to look just above it where we saw the peroneal nerve, which we just saw earlier, sitting in this location. In the center, we can focus on the popliteal vessels sitting between the two bones. To see those, we will turn color flow Doppler on and get a chance to see the arteries and the veins in this location. I've eased up my pressure on the probe on this. Just above the artery and the vein is the tibial nerve sitting in this location. You can follow the tibial nerve up as it comes and will hook up with the peroneal nerve coming across to form the sciatic nerve right here. And then we can follow this structure up even higher on the leg in this location, looking at the sciatic nerve at the distal thigh.
Let's now review the posterior medial aspect of the knee. This is an important area, particularly when looking for the presence of a Baker's cyst. In our checklist, we'll be looking at the medial meniscus and tibiofemoral joint, the medial gastroc and semimembranosus with the Baker's cyst if applicable. The anatomy is important to understand. Let's review it. Let's take a closer look at the posterior medial aspect of the knee and its important tendons. Let's remove some layers. Here we can see the key structures. The semimembranosus tendon coming down, which is primarily muscle behind the knee, the semitendinosus, which is primarily tendon behind the knee, and the medial head of the gastroc. This junction is very important between the semimembranosus and the medial head of the gastroc, as that is where a Baker's cyst will form and come through. We'll look at that in greater detail in a little bit. Just anteriorly, we have, again, the sartorius and the gracilis as well coming down to form the pes bursa. As we remove some layers, we'll get a better look at the semimembranosus and its attachment into the tibia. And the posterior medial cartilage, articular, and the menisci, as well as the MCL. Let's look at the posterior horn of the meniscus. This is very similar to the lateral menisci. I like the foot to be in a slight bit of flexion, maybe 10 to 20 degrees on this, looking at the hypoechoic cartilage articular of the femur as well as tibia, and looking for the triangular shaped medial meniscus posterior horn sitting there. Menisci sitting between, capsule above, with the articular cartilage here. This is looking at the medial semimembranosus and medial head of the gastroc coming across and crisscrossing. Semimembranosus comes down, attaches here, crisscrosses with the medial head of the gastroc. Very commonly, they get the Baker's cyst to come up here and pass through that hiatus. We'll review that in greater detail shortly. Let's review on how to look at the medial meniscus.
The next structure we're going to look at is going to be the first structure on the posterior medial side of the knee. We're going to look at the medial meniscus in the longitudinal plane. I will place my probe down in the longitudinal plane on the medial aspect of the knee and find directly the femur with its cartilaginous cover of hyaline cartilage. Just below that is the medial meniscus sitting here in the joint space. I can do some dynamic testing of that meniscus in some cases by bringing the leg up to around 40 degrees, lining up on the meniscus, and then doing some simple internal-external rotations to try to bring out subtle pathology of that meniscus sitting in its posterior horn in this location.
Let's look at the medial gastroc muscle and the semimembranosus muscle and focus on the most common area you'll be asked to scan is looking for the Baker's cysts. The semimembranosus muscle and tendon is easily seen in a longitudinal scan at its insertion into the tibia overlying the medial joint and meniscus. Sitting just superficial to this is the semitendinosus, which goes around to wrap and attach into the pes bursa. Slightly medial to this in the longitudinal plane is the medial head of the gastroc. As these tendons crisscross, this is a critical area to look for the location for the Baker's cyst. It's important if you identify a Baker's cyst to look in the short axis plane and identify both the medial head of the gastroc and the anisotropic semimembranosus, and look for a stalk to the posterior joint if the Baker's cyst is present. If a stalk is not present, one should be careful in classifying it as a Baker's cyst. It should always stalk down to the joint. Let's look at this in greater detail. Probe position, medial aspect, looking at the cross of the medial head of the gastroc and the semimembranosus tendon attachment. Again, looking at the cross of the medial gastroc, semitendinosus and semimembranosus would be coming down here and inserting. A Baker's cyst would come through this area. Let's look at how to scan the semimembranosus medial head of the gastroc in a longitudinal plane.
Our next structure to look at is going to be the semimembranosus attachment into the tibia. Semimembranosus actually has multiple attachments, but its broadest is into the tibia. We will again use our position to find the medial meniscus by going longitudinally and finding the femur with its cartilage above, the meniscus again sitting the joint space, and I will bring the probe slightly medial, and I will then start to see the broad attachment of the semimembranosus tendon coming in and attaching directly on the tibia. Just above the attachment of the membranosus is the medial head of the gastroc. You can also see the medial head of the gastroc will intersect with the semimembranosus tendon in this location. This is a very important area to look for, as that's where a Baker's cyst comes through, down from the joint, going through the cross here. You want to be able to look at that cross in great detail by bringing your probe back and forth over the cross to see the two tendons crossing both ways. Medial head gastroc and semimembranosus tendons crossing in this location.
Let's look at this in a short axis approach, looking at the sonoanatomy first. Position, semitendinosus, semimembranosus, medial femoral condyle, medial head of the gastroc. The cyst would come up in between in this zone. And here's a blown up view schematic of this. The same things. Semitendinosus, semimembranosus, medial head of the gastroc. Let's review how to scan this way.
The next structure we're going to look at is going to be the medial head of the gastroc and semimembranosus in a short axis plane. Anytime you're evaluating for a Baker's cyst, you need to make sure you evaluate it in two planes. We will again place the probe longitudinally over the crisscross, which we saw earlier. That is of the medial head of the gastroc and the semimembranosus crossing right in this zone. Once we have this zone of them crossing, we will then turn the probe 90 degrees Once the probe is turned 90 degrees, we will look for a few structures. We will see the medial head of the gastroc as this large muscle here, and we will see the anisotropic semimembranosus with the anisotropic semitendinosus above. I will then just rock the probe lightly to fill in the membranosus, and then rock it the other way to fill in the gastroc. The bursa from a Baker cyst will come between these two and stalk up. We can also follow the semimembranosus down slightly above the condyle here. Again, looking at the medial head of the gastroc and the anisotropic semimembranosus. And this is the zone we want to follow through and look at.
That completes the posterior lateral and posterior medial aspect of the knee. Thank you.